Okay, in this video, I'm going to show you how to do a dorsal glide of the capitate. Okay, often I find in people that do massage therapy, their wrists are an extension. So I see quite a few massage therapists with subluxed capitate bone, carpal bone. And so in order to get a good release of that capitate, what I do first of all is go into the thenar eminence and just do a digital release onto the adductor pollicis muscle, because that adductor pollicis muscle has an attachment to the ventral surface of the capitate, and people that use their thumbs a lot, it starts to pull on that capitate. So just a little release of that adductor pollicis muscle first. Okay, for the video I'm going to make it a little bit shorter than I normally would, and then I stretch out. And you can adduct go ahead and pull your thumb in, and then release and get a nice deep stretch on that adductor pollicis muscle. Once we've got that released, what I'm going to do is I'm going to put my thumb right in where the capitate is. Now where is that capitate? If you follow the third metacarpal to the base, and then it dips in, and that's where the capitate is. If we compare on both sides, and I did this earlier, I found that the right one is quite a bit more ventral than the left one, or palmarly placed. My other finger, if you can see, my index finger goes on the opposing surface on the palm. So basically I've taken a pincher grip of the capitate. Okay. What I do then is I traction out, so I'm pulling on the metacarpal. My thumb dips into where the capitate is. I add a little flexion. Okay, I ask my patient just to give me a little shrug of the shoulder, and that adds a little bit more traction. And then I mobilize with my index finger, pushing that capitate dorsally, or towards the back side of the hand, and that moves that capitate back into a better placement. And what that also does is open up the carpal tunnel. So if someone has carpal tunnel syndrome, there's not enough room for that median nerve and all those 9 tendons that go through that carpal tunnel, then try a dorsal glide of the capitate and see if that can open up that where that tunnel is, because the capitate is the main floor of that carpal tunnel. So that's dorsal glide of the capitate. Thanks for watching.